So one way to use isometrics I think is great. Comes from a study in JOSPT in 2015. This is Peter Malieris et al. With Joe Cook, Craig Purdom, Ebony Rio, probably one of the most famous researchers in the tendon world that I know of. They used a phased approach. So this is based on the idea that the hardest thing for a tendon to do is utilize its elastic storage capabilities, right? So when you jump, right, imagine what the patellar tendon and Achilles tendon has to do. It has to store elastic energy and release it very quickly, right? That's the job of a tendon, one of the jobs of a tendon. So if you're trying to move with a lot of load very quickly, right? Think about jumping or jumping with a weighted vest. That's a ton of stress on the tendon, okay? The slower you start to move, the less energy storage you need. So if you're utilizing isometric contraction, there's no energy storage demand because there's no motion, okay? So that was one of the reasons why people started to use isometrics, especially isometric research in, let's say, in-season athletes prior to training, prior to game situation work, just because it's probably not as much stress on the tendon. And if it warms up that tendon prior to playing, that's a big win. Now, you can use this idea in rehabilitation just because most folks, when they first injure a tendon, when they first have, let's say, a reactive tendinopathy, it's super duper tender, right? And they might not even tolerate motion at all, right? Let's say you have a really bad reactive tendinopathy in the Achilles, and I ask you to do a bunch of calf raises, even slow. Let's say I have you do it with both legs at the same time to offload it even a little bit more. It may be still too painful to tolerate. However, if we try an isometric, it might actually feel pretty good. So isometrics are a way to get some load through the tendon when things are really flared up and you can't do other forms of exercise, right? So what this study recommended is to start with isometric exercises in your patients that are really flared up. Once your patients can handle a little bit of load, we can start to load them. They recommended eventually working towards heavy, slow loads. And then once patients are tolerating the heavy, slow loads really well, we go back to using the tendon for its job, which is energy storage. So essentially adding in plyometrics towards the end stages of rehab. So in a nutshell, really flared up patients, we start with isometrics. We progress towards isotonics with heavy, slow loads and eccentrics. And the last bit of the puzzle is to get people back to sport. And we have to introduce plyometrics, running, change of direction work, whatever that is, to get the athlete back to play, right? The other place where isometrics can be a really nice option are going to be in season, right? I said this in part one of this two-part podcast series. If you didn't check out part one, do it now. It's in the show notes. Essentially, in the first study I mentioned, the second study I mentioned, they were looking at isometrics and isotonics in in-season athletes. And typically these folks tend to get worse over the course of a season, right? Not everybody, but at least the ones in my experience, they tend to get worse over the course of the season. It's just really, really tough to get them through the season and have that tendon pain go down. However, isometrics aren't that much stress on the tendon. Tendon's probably already taken too much stress because this athlete is trying to continue playing their sport, trying to continue practicing. Their pain continues to go up and up just because it's too much volume for that irritated tendon. If we add more exercise on top of that, heavy, slow loads, eccentrics, it might be too much. It might even make them worse throughout the course of the season, right? So if you utilize isometrics, it's not that much stress on the tendon. So in season, it might be a really good option for these athletes to get a little load through the tendon, reduce pain without going overboard, right? The last place I like to use isometrics, and we kind of noted towards this a little bit earlier, is I like to use it in a warm-up, right? So let's say you have a patient that always has shoulder pain, right? And it takes them 20 minutes to warm up every single bench press day just so they can bench press and get through the workout, right? Now, this person, and I'm sure you've heard this story, has had pain for the past 5 years. And all they do is warm up their tendon for 20 minutes prior to bench press every single Monday, right? And their pain doesn't get better. Now, isometrics can be helpful for this person, but you have to figure out why they're hurting in the first place. This person is not going to do well if you just give them a warm up and tell them continue doing what they're doing, right? They'll probably have pain for the rest of their life. So you have to make sure as a caveat that you figure out the reason why your patients are having pain. You have to maybe back off of some of the load that they're using during bench press. Maybe they need a higher frequency of exercises to stress whatever tendon is giving them pain. And as long as you're doing that, I think adding a nice warm up makes your training go much more smoothly. So I've posted a bunch of warm ups I like to use in folks that have tendon pain. I'll put some links in the show notes so you guys can definitely check that out. But a good example is a shoulder warm up prior to a bench press day or prior to an overhead press day. I'll have athletes perform a scaption isometric, a pec fly isometric, some external rotation isometrics, and then I'll have them perform a lot of warm up sets before they do, let's say, a bench press. And oftentimes it allows them to train much, much more comfortably, right? And I think you can use this for multiple tendon problems. I had mentioned this previously, but in my patients that have a quad tendinopathy or they have a patellar tendinopathy, one of the things I like to do besides just isometrics is to try some isotonics, like using reverse sled drags, maybe walking backwards on a treadmill, doing some sissy squats, some turtle knee extensions, some sissy squat turtle knee extensions, right? Maybe we also add in some knee extension isometrics. And what you may find is that these athletes can now move a little bit better. Let's say they do this prior to a squat day and they have been compensating a little bit toward those heavy sets just because the knee is so painful. Now, when they get to those heavy sets, you're not compensating anymore. I think that's a major win. I think the other piece where this is especially helpful is from a psychological standpoint, right? Oftentimes you have those athletes that are kind of afraid to push through pain. Now, don't get me wrong. A lot of the athletes I work with, they push through way too much pain. And sometimes I'm actually trying to give them a little bit of fear and just let them know, like, hey, you shouldn't be pushing through as much pain. It's probably why your tendon pain is getting worse or not improving, right? I'm not talking about those folks. They probably don't need isometrics. They probably just need to listen to their bodies and back off a little bit. But for the folks that are a little bit more fearful of training, isometrics and isotonics can be really helpful just because whenever they feel some pain in the gym, they often get scared and they get very frustrated, right? They feel like they need to stop. So if you can make them feel a lot better and they have substantially less pain in the gym, this is going to allow them to continue training, which is going to push them in the right direction, obviously. And they won't be as frustrated, right? And they're much less likely to be fearful of movement if the movement is not painful. Okay. So there's a variety of situations where you can still use isometrics in your rehabilitation. However, I also like to think about using isotonics and basically just utilize what works best for your athletes. Okay. Everyone's going to have their own specific needs, right? Think about sports specificity. Is your athlete trying to get back to squatting, right? Are you working with a power lifter or are you working with a jumper? Because a jumper is going to have to get back to a lot of plyometrics, but an Olympic weightlifter, not quite as much. Do they move a barbell pretty quickly? Yes, they do. But are they moving it with the same speed as they would in, let's say, a jump, right? Is a tendon having that same demand? No. So they probably need to be treated differently. So keep that patient in mind as well. So if you are loving what you are learning right now, I highly recommend you check out my fitness pain-free episode where we go over a patellar and quadriceps tendinopathy guide. I will leave a link in the show notes. Definitely recommend checking it out. You can also click on the link right above if you're watching this on YouTube and get started watching right away.